Questions and comments. The Honourable Government Deputy House Leader.
So, Madam Speaker, I've heard a number of Conservatives use the same line. Only 18%, 1 out of every 5 Canadians think that this should be a priority. So I guess the fact that 1 out of every 5 needs something, that's not enough for the Conservatives. Okay, what is their number? When does it warrant a program? If it's not 1 out of every 5 Canadians, is it 2 out of every 5? Is it 3? Is it 4? Or is it when everybody demands this program? Can the member just tell me, if 1 out of 5 Canadians needing this is not good enough for him, what number will they realize, or will they accept that, yes, it is good enough for Canadians?
The Honourable Member for Red Deer Lacombe.
Well, thank you, Madam Speaker. Healthcare delivery is provincial jurisdiction. The private healthcare that's out there right now, the private insurance that's already out there, are already talking about how their systems and their programs, which deliver tremendous results for Canadians, are going to be undercut, and it's actually going to lead to a public system that's not going to offer the same value and benefits that the private system already does. So we're going to respect provincial jurisdiction. It's too bad that this government has squandered $600 billion in debt and the debt servicing that goes along with it, that we're actually spending more on servicing our debt than we are on healthcare transfers. If only we had prudent fiscal management, we could transfer the money to the provinces so that each province can make a decision for itself what coverage it wants to have for its citizens. That's the way Conservatives would have handled this.
Questions et commentaires.
Questions and comments?
L'honorable député de Mirabel.
The Honourable Member from Mirabel. Thank you, Madam Speaker. We're going to repeat the same question again because it is the most important thing for us. Our colleague finished his speech and said that Ottawa is mismanaging public funds. My colleague says we should send the money to the provinces who have their own jurisdiction, should decide what to cover or not cover. You know, Quebec already has its own coverage, better than all other provinces. So in this context, how is it that last week a colleague voted against the Bloc sub-amendment to request to be able to opt out with full compensation for these federal spending programs that intervene in provincial jurisdiction? Did he change his mind? Does he support opt-out with full compensation as members of the Legislative Assembly supported unanimously?
So, Madam Speaker, we simply oppose this particular plan because we know that this plan is nothing more than the cost of the agreement between the NDP and the current federal government. It's not a serious agreement in the sense that we're actually getting a national pharmacare program. So, as I said in my previous comments, which I would have already answered my colleague's question, this is much better delivered through provincial jurisdiction. And as an Albertan, and he as a Quebecer ought to know, there's one thing that Albertans and Quebecers often have in common. It's that we know how to look after our own people best, and we don't need these federal intrusions into provincial jurisdiction.
That's a good answer. Yeah.
Questions and comments. The Honourable Member for London Fanshawe, brief question.
Thank you, Madam Speaker. I'm curious. It's shown that the Conservative Party of Canada is actually riddled with corporate lobbyists in terms of its governing body, lobbyists for big oil, real estate, anti-union companies, insurance companies, big pharma, and it's in fact being used using those same talking points from those corporate entities in their conversations today against this bill. So ultimately, I would like to know if this member is actually defending his constituents or the corporate interests of those big lobbyists. Thank you, Madam Speaker.
The Honourable Member for Red Deer Lacombe has 1 minute to respond.
Well, Madam Speaker, I think the individual that just asked me the question had her answer in the question itself. Support for Big Pharma. Well, who's supporting Big Pharma with this piece of legislation? The NDP and the Liberals. National Pharmacare Program will do more to help the pharmaceutical industry. Why don't we just examine that for a second? Everything that they say they're for, they're also against. This speaks to the same hypocrisy that the NDP has on everything that they do. They want more pharmaceuticals and they're supporting Big Pharma with this piece of legislation. More government money, more costs going to the pharmaceutical company, and accusing Conservatives of being in the pockets of Big Pharma. Ridiculous.
I do want to remind members, I know that there seems to be a few of them that were trying to participate in the answer of that question, and I would just say that, you know, unfortunately, if they're not being recognized, they should hold off on their thoughts until they can be recognized.